Hi, I'm Dr. Lingham. I'm from Vida Senior Care, and I'm also a registered medical practitioner in Malaysia, currently practicing at the Mediveron Clinic in Jalan Gasing in PJ. I'm also a part-time lecturer at the Monash University in Sunway. I'm here to talk to you a little bit about aging and the degenerative changes of the brain. What is dementia? Most of the time, dementia is the process of aging where one generally begins to have some sort of impairment or failing in memory. Most of the time, you notice that the memory loss is recent memory, like what happened that day or what happened in the few minutes before that. And the long-term memory is actually intact. They can remember what happened when they were young, what happened when they got married, when they had children. All those incidences are actually very, very intact. But it's what they had for breakfast or what they had for lunch, whether they have been fed. Sometimes even after having a meal, they will say that they have not eaten and things like that. Now, those are signs that someone is actually getting demented. Now, dementia is something that happens very gradually and doesn't have a very clear-cut onset. You gradually see this thing happening and changes that are taking place in someone that you love. It's more common amongst people who have had a past history of depression. Generally, this individual does not have any insight. He doesn't really realize that there's a problem with him, and he is ready to give up a task. He is unable to complete it, and then he gives up. And he can complain bitterly. Is something that you might see as a change from someone who doesn't complain and is positive about everything, who suddenly starts not being very happy with everything that is either given to him or asked of him. If you did some cognitive testing and you sort of asked him what day, what date, which year, where he was, he may not be able to answer those questions completely. He may have some issues with carrying out basic arithmetic calculations, like if he bought something for 7 ringgit and someone gave him 100 ringgit, then how much change should he have? He may not be able to actually compute that clearly, and those are again warning signs that this individual may be starting to develop dementia. He may be depressed and you may not even know that. It's vital to detect this early because they may become suicidal, and there is this sense of hopelessness. Sometimes dementia can mask depression, so be careful, and it has to be assessed separately, and assessment must be done by a trained professional. If you feel that you need to reach out to us, then you would want to actually communicate with us straight away. Our contact details are on the website. Thank you.